Hi, everybody. Thanks so much and welcome for joining us on another fabulous episode of Let's Kvetch.
What? It's already fabulous?
When you're here...
Okay, because we know it's going to be fabulous.
Right.
Because we have an incredible guest with us today. An incredible
guest.
Yo, welcome to the show. It's Let's Kvetch, where mindful speech and wisdom always stretch. Rabbi Raphael, Howard on the mic, dropping Torah gems every day insight.
Before we get to our guest, I just wanted to say, I wanted to wish our dear friend Howard happy birthday, Mike.
Thank you.
My co-Kvetcher.
Yeah, that's right.
Do you have a birthday Kvetch particularly you want to share with everyone?
I got a list. I have several items here to... Okay.
Stay on camera.
Okay,
Don't go anywhere.
Okay. No, I didn't write it down. I wasn't prepared. Had you told me...
I know.
You wanted me to give a list?
Well, it's a surprise birthday episode. I wanted to remind everyone, I was thinking as we did this podcast, we were going to get a lot of people that were sending in their Kvetch. And so far, the only comment that we've had so far has been positive. It was a positive comment. People are not kvetching to us. And
because there's no email that works.
Well, there's that. They can always call.
Okay, good. Okay.
Bring in the call. See, you could, if you want to call us and share your Kvetch.
That's what I say. It's probably easier to get us on this phone, this bat phone here, than email us. Because you're right.
For those on the audio podcast, we've got a little toy Fisher Price phone, and you could try to call us on that, or try to email us at howard@cleanspeech.com.
You can try.
And submit your Kvetch.
Right.
Or you could always comment on any of the platforms. That works too.
On YouTube, that's where we got someone to comment.
And it was favorable, as I said.
It was very nice.
Very nice. Keep them coming. But really, as when we had Shua Horowitz on,
yes.
So a well-made point of his was, it's good to hear feedback, even if it comes across as a Kvetch. It's a good thing.
Right.
Yeah.
Right.
And,
it's how you deal with it, in a constructive manner.
How you respond to it, and if you don't hear it, then you're worse off. You're not better off. You're worse off for not hearing a Kvetch.
Right. But so this is a good lead-in because we have a guest who hears a lot of Kvetching. So
Without further ado, let's get to our guest. Shall we do that?
Fine,
okay.
fine.
We'd like to today. This is the medical Kvetch episode, which we knew was coming because in any podcast about Kvetching, naturally,
it's a natural, and this is a real natural because of what he does, what he specializes in.
Right.
Okay.
Dr. Shimi Blau.
Right.
We're delighted to welcome you to the guest
Okay.
as a
Shimi,
guest on the show.
roll in.
All right, thank you.
Look
Thank
at
you
that.
guys so much for having me here.
Now we're rolling.
Hey, man, Howard.
Okay.
Dr. Shimi Blau, good friend, is a doctor of interventional spine and pain medicine, and he agreed to join us as the first. Maybe we'll have other Jewish doctors on the show. This may work out for we may have a couple of episodes about medical Kvetching.
There's a lot of us Jewish doctors. Yeah,
And there's a lot of us Jewish medical Kvetchers, meaning we love to share, at my age, at Howard's age. He's having a birthday. Did I mention Howard's having a birthday on the show?
Howard.
And now that you're this old, we won't tell you how old. Do you have any aches and pains you want to talk about?
The last couple of weeks, let me tell you, have been a little rough.
I'm so sorry.
No, but you don't want to hear those details.
You don't want to know? No, we want to know. That's for the show.
This is not something for Shimi's specialty. It was something else.
Thank God. You don't have any interventional pain and spine medicine needs?
Yeah,
probably better.
Yeah, for the best.
No, you always have. I don't know. Percentage-wise. For somebody my age, what are they?
How old are you? What is your age?
Well, sure. So, anyways,
Do you know the percentage of people that have arthritis over the age of 65?
No.
100%.
Wow.
Whoa.
In other words, if you do X-rays on somebody over the age of 65, you're going to find degenerative changes and arthritic changes.
Oh, my
It doesn't mean everybody's got pain.
But it already starts.
But the body does start to break down. Yeah.
Wow. This is like a hot off the presses news item that broke on Let's Kvetch. I never heard that before. I'm sure none of our viewers ever heard that before. If you're not a professional, you don't know. Are you saying that of us?
Everybody has degenerative changes by the age of 65. And the truth is, I deal a lot with the spine, and I start seeing degenerative changes really at the age of even 25, 30 a lot of times.
Okay.
They're mild, but they're there.
Before we get into it, let's take a step back.
Okay.
I don't even know what an interventional spine and pain medicine doctor does.
Yeah.
What do you do?
So what do? I deal with patients that have all sorts of pain issues. So particularly joints, particularly the spine. So somebody that might have arthritic changes, somebody who might have a herniated disc, for example.
Ouch.
The interventional part refers to procedures that I do, such as epidural injections, facet joint injections. But I do all sorts of procedures on people to try to make their pain go away, so that they feel
But you
better.
don't do you're not a surgeon. I mean,
I don't do surgery. A lot of the procedures I do will be done at a surgery center because we use X-ray guidance. So we use a very fancy machine. But, yeah.
So if I understand you correctly, you are like the perfect guest for Let's Kvetch. Meaning to say,
I hear a lot of kvetching in my line of work.
that's with a person with a
That's
kvetch
what I'm saying.
they come to you.
Right.
Yes, exactly.
Right.
Amazing.
If it's a pain kvetch, yes, they come to see me.
Yeah.
So on a hierarchy of kvetching, then to the degree of what they have, is it just a normal part of aging?
I don't understand the question.
Well, to me to say that.
Is it because you're getting old that you're asking this question? You're having a birthday and now
Well,
you're
listen,
wondering, can you make him an appointment after the show?
I make house calls. We'll do a house call.
Yeah, thank you. Yeah. Well,
Ooh.
you heard it here first. So you said it's a natural, almost a natural progression.
Yes.
But
yeah.
at certain ages, does that increase? Is there things that also that they can do to avoid certain things, or it's just?
Oh, I mean, exercise is always great. Exercising, especially when you're younger, can help sort of defray a lot of those pain symptoms till later on in life. But the truth is, I see a lot of people that are involved in traumatic episodes, car accidents, things like that, and I take care of them. Those are, I see everybody from 10 years old, sometimes even 7, 8 years old, all the way up to their 80s and 90s. I previously practiced in Boca Raton, Florida, and I joke that the average age of my patient was 85.
Wow.
I
He's
used
really
to see-
older?
I used to see a lot of patients, even over the age of 100. And a lot of them didn't even have any pain symptoms up until their 90s.
Wow.
Because they kept in really great shape. So it really just kind of depends on genetics and how well you kind of take care of your body.
Well, look, I mean, nobody likes pain.
Yeah.
So
Yeah.
you're hearing people at their worst, but how much?
Let's hear about that.
Let's talk about the empathy
Yeah.
that you have to have, because they're going through some stress.
Oh, absolutely. Yeah. I mean, I
Okay.
think any decent doctor needs to have at least a fair dose of empathy. You want to relate to your patients and know that you want your patients to know that you really care about them. And if you care about them, you're going to treat them well. So that's just kind of a given.
Yeah. However, you are really in the hot spot. I mean, people come to you with pain. When you're suffering, they call you.
Exactly.
So
right.
how is that? How has it been managing or at the I don't know, the tail end of a career?
Yeah.
You're not at the tail end, but
Yeah.
wherever you are in your career, after a career of listening to people kvetching.
Yeah.
What can you tell? What do we learn from you? I mean, you're an expert.
Well, I tell you, there are certain things that I can help relieve. For me, I think one of the most frustrating parts are that there are people that end up having chronic pain symptoms, and those patients need an extra degree of empathy.
Chronic means you can't help them.
Or if you can help them, it's temporary, but the pain keeps coming back, or it's always there. Even if you help them, you only help them a certain percentage. You bring their pain down a little bit. Those are very, very, very challenging patients for me to
Sure.
manage. I always try my best. And there are a lot of patients that I can, with just one injection or 2 injections, I can make them feel great, and they never come back to see me again. Other times, I have patients that I see, once a month, once every couple of months. Trigger point injections every 3 months.
Why does a person like that come to you so frequently? I mean, is it what is not happening that should be happening, or is there nothing?
Well,
else
so
that
I'll
can
give you
be
an
done?
example. Fibromyalgia is a great example. And
Talk
fibromyalgia,
about what is that?
So fibromyalgia is a condition where people have kind of diffuse muscle aches. And in the world of medicine in general, this is one of those conditions which there are a lot of doctors out there will tell you that they just don't believe in it at all, even though there's
Right.
a lot of research behind it. And there's certain famous people actually that have this condition, and it causes chronic muscle pain and fatigue. There's certain medications that can help, but it's very challenging. very, very challenging. You know, a lot of patients will have tried all the medications, they don't really work, or they only work to a certain degree. A lot of those patients do well with physical therapy a few times a year for flare-ups, or trigger point injections. So they'll come back to see me every 2 or 3 months, and we'll do some procedures for them and sort of just kind of keep their symptoms at bay.
Are you saying, though, that this is possibly a person coming to you without a real problem, but just a sense that they're in pain? They're in pain, but there's nothing really to treat? Is that what you're saying?
No, it's a real problem. I mean, fibromyalgia, I believe, is a real thing. There's certain studies that have shown that there are actually changes in their brains, for example. So it's a real condition. It manifests in different ways, but muscular aches is the real kind of number one thing that they all have in common.
And they don't come to you for a solution for the problem. They come to you for relief from the pain.
Exactly.
And that's different than solve my problem. It's just help me with the pain.
Yeah.
Right.
Okay.
Because again, nobody wants to go through pain. It's just like,
no,
deal with that and let me go on my way. Let me go get back to life.
Right. And a lot of times people have been to tons of doctors, and the doctors sort of discount them. Other doctors might discount them. So by the time they see me, they're used to sort of getting the cold shoulder, and they're kind of dissuaded by the process that they've been through. So I try to make.
Let's take a turn here. Do you also get people that you think are complaining and there really isn't anything bothering them? Do you get a Kvetchers that are just coming to you to like pull your ear and Kvetch, and they want pain meds?
That happens. See, that happened early in my career when I used to do pain medication management. I don't really do a lot of pain medication management anymore. There's a lot of government oversight. There are still a handful of doctors that will do that. They specialize in that. I got out of that for a lot of reasons. One of the reasons was because we had a lot of drug seekers. And, it was actually very, very, very scary. We had to call the police a couple times on some patients.
Wow. Yikes.
There was... Years and years ago, when I first started here in Colorado, I remember that there was a certain physician. I think he's either retired or lost his license by now, but he had one of these. It was known as a pill mill. That's what they're called, the pill mills.
A pill mill.
And he was just
Is that like a placebo? No.
No,
they were like he was just giving out pills.
He was prescribing a lot of opioids
I got it.
without the proper oversight. And without doing due diligence, so the government was sort of already on his they had him on his on their radar. They brought me into this practice to sort of help out and clean up the mess that was created by this, and it took me several months. We had a lot of angry patients when I said, we're gonna have to cut back on your meds, or we're gonna have to discontinue them. I believe we called the police a few times during that period.
Wow.
It was
Kvetching just got out of hand.
It got out of hand. But you had somebody like on enough opioid medication that could kill a horse, and there was the police actually came to us and told us that they had found him selling these medications on the street.
Wow.
Yeah. So pain management can be a tricky business.
Yeah, especially in Colorado here.
That's right.
You got a lot of tricks up your sleeve here in the
You
state.
don't have any fentanyl though.
Fentanyl, no. Not in my back pocket.
No, because
you're getting old.
We actually do give fentanyl when we're doing procedures sometimes. Like if we're doing a procedure, we'll give it IV, but it's monitored very carefully and very low dosages. Yeah.
Yeah.
I also want to go to a different direction. You have a life outside of your day job. What do you take in? What do you internalize, or what do you walk away from? How do you do that? How do you turn that part off when you leave the office?
Wow, that's a great question.
Did you hear that?
Yeah.
Great question.
Yeah, I'm very lucky that I'm in a field where
no one's ever said that.
No one's ever said that to Howard. This is a first episode on many levels. Howard, that was a great question.
How much time was it? Can we put that in the show notes? Howard asked a great question.
Okay, so how do I turn it off? Well, I'm very, very lucky. I actually started out doing general surgery. My internship year was in general surgery, and this is my turn to Kvetch. I hated it, and I could talk for like an hour about why I hated general surgery.
Maybe we'll do a med student episode.
Yeah, right. So but one of the things that I saw was that like these attendings were working night and day. They were being called in the middle of the night, and that wasn't a lifestyle that I wanted for myself. So I'm very lucky that I went into a field that, we don't have a lot of emergencies per se. And we do have a call system amongst the partners in my group. But since finishing residency, I've never had to work a day on Shabbos or Yontif. I've never had to take a call or return a call on Shabbos or Yontif. And I'm very, very lucky and grateful because of that. I did not want to have to go into the office on Shabbos. And I know there's a lot of heterim, there's a lot of, leniencies for doctors to go in, to save lives. I get it. I wanted no part of it. I wanted Shabbos for myself. I wanted Yontif for myself. So I was very lucky and very fortunate that I was able to do that. On a day-to-day level, I don't know if I ever completely turn it off. There's a lot of times where I'm working late at night. I do a lot of like medical legal work as well. So a lot of that, gets, it's not really seeing patients, but it's like reviewing a lot of records and things like that. I'll do that in the evenings sometimes. It's hard sometimes to turn it off completely.
Yeah. We bring, by the way, we bring the Kvetching work home with us also. It's hard to just turn it off when the show ends. It always goes with us. So
one of the reasons I went into the field that I'm in is because I realized, like going to shul, people didn't come over to me and ask me, hey, my kidneys are hurting, They'd come in, they'd say, my elbow's hurting, my shoulder, my knee is hurting. So, and that's what I do. So that was like the biggest complaints that I would get in shul. And that's why I went into that field.
I've asked you certain things over the last few years.
Sure, absolutely. And I actually love it. I love to be able to help people, at least to give them advice and point them in the right direction.
That's beautiful. That's a great attitude. What a nice response to Kvetching. A nice response to Kvetching is, how can I help? I'd like to help you. Tell me your Kvetch.
Right, exactly.
Is that on your business card?
Yeah.
Okay, Dr.
I should
Shimi.
put that on, yeah.
Kvetch to me, baby. What?
Well, one of my daughter-in-laws is a PA.
Yeah.
And, but she works at a hospital in the Bronx and at night. So
the night shift.
A night shift. I mean, she does
gunshot wounds.
Well, she's with kids, so she's a pediatric PA.
Okay.
Whatever that's So, but still, I mean, I don't know if the call level goes up at those points, but she's and she also doesn't talk about it, but I see how she because Baruch Hashem, she has 4 kids, and when she's home, she's dealing with her kids.
She can switch it on and switch it off.
Switch it on and switch it off. That's right.
Yeah.
Right.
Speaking of switching it on, switching it off.
Yeah.
Let me ask you. Let's say you get a patient comes in, okay, and they're telling you, doc, let me tell you, what's wrong? Let me tell you, and they're just going on and they're going on and they're going on. Like, I can imagine that, having a doctor, a pain med doctor, if I were in there and I would just
from A to Z,
just go for it.
Yeah.
How do you handle that?
So I think.
How do you redirect?
Maybe I'm giving a little secret to your listeners here. I think every doctor's worst nightmare is somebody that comes in and you ask them for a history of what's going on, and they start with their birth. And they just go like through grade school and high school, and they're just going through their whole life history, right? I remember in medical school, they would teach us, they taught us when we were learning how to do physical examinations and take histories. They said, always ask open-ended questions. Let your patients talk. Let your patients talk. And it's great. It's great when you're younger and you're just getting started because you're still learning. The truth is, once you're in your career and you know what you need to know. You can control. Yeah, there's certain information that I need to know to make a diagnosis and to know what to do. And when people start going off and it's not relevant to what I need to know, there is a certain amount of redirection. Yeah. And it's challenging. And you have to do it with a lot of patience. A lot of patience.
A lot of the people that come in, or you have to
with patience.
I'm sorry. I knew that joke was going to come up.
Patience.
But so this redirect, now, I'm very interested in that because I think that not only in your particular field, but something that we all probably could learn from you would be, even outside of the doctor's office, people are kvetching to us.
Right. Yeah.
And the kvetching goes on, and it goes on, it goes on. You don't need all that kvetch. And you need to learn how to redirect in a sensitive and a patient and appropriate way. Tell us how you do that.
So I think that the first thing is I I never am impatient. You know what I mean? Because if you show impatience, then people feel that. And people can feel energy, you know? But I'll usually say something that's very interesting. It's, you know, thank you for sharing that. What I really want to know is X, Y, and Z. This is going to help me out here if you can explain this.
So you're steering them a little bit.
Right. Or a lot of times I'll tell them, okay, well, let's start from here. What happened here? And, you know, what did you do? How did you do? So I'll ask some more pointed questions to try to sort of redirect.
Yeah. I like that.
Yeah.
Asking pointed questions. Thanks for sharing, but how about let's talk about this? This is something that, again, it's...
Or we can come back to that later.
Let's come back to that.
On this.
And let's talk about something else now.
Right.
All these are great redirect techniques that I think that obviously you've had to pick that up, and we could...
Well, I saw my primary this week.
Did they redirect you? Did you start telling them your whole life history?
So, yeah, I mean, you open up, what's wrong? And I'm like, where do I start?
How much time we got, Doc? This is exactly what he's talking about.
Right. Well, I thought it was a little odd that he said, wait a minute, I got to lay down. Okay. No, this is great.
I am sure that this episode is going to resonate with many of our listeners, because how many of us have the cracks and the aches and the pains?
Yeah.
You know?
And the pain of not being able to email us.
Oh, wow, that's brutal. Hey, Howard, just twist the knife, you know? We'll get you an email. It doesn't work. Here's what he means. But the email, we'll get it fixed.
And, you know, we haven't even, lately, haven't talked about our sponsor.
We have a sponsor? Crickets. Okay. All right. Thanks for being on the show, Dr. Shimi.
If you
wanted
so much for having
to
me.
sponsor, that's amazing. If you want to tell all your friends, you were on Les Kvetch. Do we have some swag for him for being on the show?
You know, one of these stuffed animals. That's right.
All right.
No, we have a clean speech.
Maybe the Fisher Price phone he could have just for...
Do we have any more of the clean speech?
I'm trying to declutter my home.
Doesn't want any
well, this is a wearable item.
Let's Kvetch
so
swag.
this is a wearable, you know.
Or a clean speech wristband.
Yeah.
All right.
All right. Don't forget to click, like, subscribe. Please share with your friends, whatever platform that you're watching or listening on. We thank you.
And don't forget, Kvetch responsibly.
Yo, welcome to the show. It's Les Kvetch, where mindful speech and wisdom always stretch. Rabbi Raphael, Howard on the mic, dropping Torah gems, everyday insight. Let's Kvetch, let's not forget. Choose words wisely, no regret. Guard your tongue, learn the flow. Jewish vibes on the podcast, let's go. From Lashon Hara to keeping speech kind, every syllable affects the divine. Pause before you speak, breathe and reflect. Every day my Vaughn earns respect. Howard's got the laughs, Rabbi keeps it deep. Lessons on the lips for your soul to keep. We're talking truth, talking shalom by it. Heart stays soft when the tone stays quiet. Let's Kvetch, let's not forget. Choose words wisely, no regret. Guard your tongue, learn the flow. Jewish vibes on the podcast, let's go. Rhythm of the mitzvah, speech is gold. Lesson in restraint, let the story unfold. No gossip, no hate, keep the temple clean. Listeners engaged in that mindful routine.